before and after the varicocelectomy. So this group shows the parameters or the values pre-operative. So this post-operative parameter values, then the improvement which had after varicocelectomy. So in my sample or our sample, motility, progressivity, viability, concentration and normal morphology all were below the standards. Motility 7.5, normal standard is up to 50. Progressivity, it's I mean the criteria or the assessment which we adapted at Ruhuna. I'm not going to explain the technical details. Viability in our sample is 24.8, but the normal value is about 60. The, not in, I mean, Sri Lankan samples. Is, for Sri Lankan males, it's about 50. Concentration for 5.4, the normal standard's 20 or less than a little bit. Then the normal morphology is again 30, following HN, I mean, Neosine Nigrosine method. So these are all the parameter standards were below the normal in pre-operatively, but post-operatively we noticed a marked improvement. And the motility from 70 to 38, progressivity 1.2 to 2. This is the accepted value. Then viability reaching the 50 almost, 48 in our sample. Concentration again reaching 18.86 toward 20. Then the normal morphology exceeded the standard we expected, 33. So the improvement regarding the motility, 20.8 improvement. Then the progressivity 1, viability 23.9, concentration 13.36. Then the normal morphology 17. That means our sample showed marked improvement after the varicocelectomy on these patients. Then the number of pregnancies reported, we got within this about 3 years, we had 8 pregnancies. The 21.6% of the patients who has undergone varicocelectomy reported pregnancies. In other countries, actually, they have recorded around 30, but in our sample, 21.6. Then 4 pregnancies were natural, and another 4 pregnancies after doing IUI. The conclusions: varicocelectomy appears to improve the seminal fluid parameter abnormalities and pregnancy rates. Then the properly designed randomized control study is proposed, because actually the sampling method which I adapted there is convenient non-randomized. That's why I can't generalize the results. But we are conducting the research still. It's not actually randomized cohort types study. I am designing and I am conducting that. So these are the conclusions. Any questions, please?
It's open for discussion.
May I know whether the improvement in the parameters that you tested were different in bilateral varicocelectomy and unilateral?
Yeah, actually, sir, that part I haven't included that part there. What I noticed, I further analyzed. I mean, still I am getting, I mean, collecting the data. I did notice difference between bilateral and unilateral things. But when you compare the grade of varicocele, there is a marked difference between the improvement between grade 3 and grade other grades. So the behavior of the improvement among grade 2, grade 1 and subclinical is almost same. But there is a big difference between grade 3 and the rest. The grade 3 people are not responding well, it seems.
In your results, I saw that about 100% increment instead of the number improvement in the number wise, if you see the results, there is a 100% improvement about. 70 has become 38, that's 100%. One is 2.2. 24 again 48. The 5% 18, that 200% income. So I think in the results you may have given the percentage improvement or statistical analysis.
No, it's, I mean, the percentage.
Percentage improvement is
No, this improvement means the mean mortality of the preoperative sample is 7.5.
Yes.
Then the mean postoperative sample of mortality is 30.8. It's not related to the number of patients.
So what I see there is improvement is 100%.
I didn't get you, sir.
So other thing is, I thought you can give percentage improvement rather than just as a value. So second thing is you may have done the paired t-test. So then significant difference. So these are what's called the before and after surgery. The paired t-test may give a better statistical phase.
Actually, sir, I didn't analyze this data using any statistical...
So I'm making a suggestion.
That is what he's suggesting, that you should do that.
Yes, only thing, my sample is a...
Very small
it's
sample.
a convenient sort of sample. So I use I prepare this presentation for this symposium. So, I mean, the next step, definitely I will...
this is a suggestion only, not to criticism. This is a suggestion. Okay. You may have given the percentage improvement and paired t-test.
Yeah.
So again, something related to. So this again question you said highly controversial. So if one-sided test is there, what I have learned in physiology is two testicles is luxury. One is more than enough. So so with that, I'm not sure why this hydrocele is causing the.
I can answer that question. There are several mechanisms for causing subfertility or seminal fluid parameter in varicocele, patients with varicocele. So still, I mean, the exact mechanism is not known. So if it is due to some sort of chemical, so it can be affect the other testes. Then some group actually describing this using testosterone. So if you are having varicocele in left side, so it will reduce the testicular size, depleting the testosterone. So then what's happened, if you are having, I mean, the less testosterone, your LH and FSH will increase. Then the FSH, though it is essential for spermiogenesis, more FSH stimulate your seminiferous tubule Sertoli cells more, causing free radicals. Then free radical is harmful for sperms. So motility, morphology, and concentration both get affected. So even though this is considered as a one-sided problem, the effect may be in both sides. So these things to be, I mean, clarified. More research need to explain all these things.